All right, my friends, time for another Dr. Glaucomflecken reaction, this time, Golden Weekend. Let's dive in.
Hey, how was your weekend?
Oh, it was awesome. I had a golden weekend. I got a lot of stuff done.
Golden weekend? What does that mean?
Oh, it just means I had the whole weekend off.
So in both your clinical years of medical school, your third and fourth year, as well as in residency, you're usually working 6 days per week. Again, it depends on the specialty, depends on the rotation. If you're working 6 days a week and you have that 1 day off, then over any given month, you have 4 days off, right, for the 4 weekends. Now, you can do just 1 day off every week, or what you can do is you have gold weekends and then black weekends. Now, on golden weekends, you have both Saturday and Sunday off, as most non-medical people normally do on the weekends. And then black weekends is, that's when you're working both Saturday and Sunday that week. But you're supposed to, on average, have 4 days off every month.
Oh, okay, like a 3-day weekend. Oh no, I worked on Friday, but I had Saturday and Sunday off.
So you just had a weekend off?
Yeah, but I had both days off, Saturday and Sunday.
Isn't this so funny that in medicine, this is like a special treat, and yet to everyone outside of medicine, this is just, it's so backwards, right? The medical training system treats medical students, and especially residents, as cheap labor rather than trying to optimize their learning.
Okay, that's just a normal weekend off.
Yeah, but it was a golden weekend, so I got to leave Friday afternoon. I didn't have to come back to work till Monday morning.
And that's exciting to you.
Yeah, it's 2 full days off.
So you got a college degree, and then you went to med school for 4 years to get another degree.
Yeah, that's right.
So after years of advanced education and training, you are now at the point where you're just excited to have 2 consecutive days off.
Yes.
It's funny because it's true. All right, so, even the whole 4 days off per month is like a guideline, but a lot of programs don't always stick to that. I can think during my medical training, there was a rotation where I worked 21 days in a row. And I don't think I got 4 days off that month afterwards. I probably got 2 or 3 days off. Working those 21 days, it fucking sucked, man. I'll talk about this a lot on both this channel and on Med School Insiders, which is that we need to stop treating residents as cheap labor and try treating them as future attending physicians that need to be trained to practice independently in the maximal capacity. But as always, kudos to Dr. Glaucomflecken for shining a light on the truth of medicine in a very humorous and effective way. All right, up next, we're gonna do how to fix burnout.
Sir, you wanted to see me?
The resident's in trouble.
Yes, Bill, please.
Per usual.
Come in.
Okay. Bill, it's been brought to my attention that you haven't done any of your resiliency modules. Oh yeah. You do know that physician burnout is a huge problem right now.
Yeah, I know.
So what do you think we should do about physician burnout? More days off?
Yeah, more days off is the answer. And the reason we don't have more days off is because hospitals use residents as cheap labor, and then also attendings from yesteryear, from prior generations, say that,
hey, I worked 120 hours a week, therefore you should too, because that's what makes good surgeons and doctors and whatever.
Which isn't true, because things like sleep deprivation, learning while sleep deprived, memory consolidation, et cetera, which we don't have time for in this video. But let me guess, the answer is more resiliency modules.
No, a mandatory 8-part online curriculum designed by people who have never taken care of patients. Really? That's the best way? Of course it is, but how can we measure your gains in resiliency and ultimately publish it in the New England Journal if you don't finish the modules? I mean, I could just tell you right now it's not going to make me feel better.
Funny, cause it's true.
Whoa, we'll let the 4-page self-assessment questionnaire answer that. Oh God, what if I don't do it? Well, then you'll have to complete a 3-hour course on the importance of professionalism. Fine, but can I at least have the afternoon off to finish the modules? No, you can become resilient on your own time.
Yeah, huge problem in medical training, which is that they know that burnout, depression, suicide are huge issues. It's received a lot of publicity in the last several years. And rather than actually fixing the problem by addressing the root cause, the administrators and hospitals, they just pay lip service and have these modules, which is ironic, right? Because what you need to recover properly is more time off, sleep, exercise, etc. not just working more and more, and now they're forcing you to essentially work for free with these resiliency modules because you're not getting paid for that either. It is a huge joke. As always, Dr. Glaucomflecken hitting the nail on the head, and funny as always because it's true. That's it for this video, my friends. If you have any other videos you want me to react to, leave a comment down below. And if you haven't already, check out this video or that one. Much love, my friends, and I'll see you in that next one.